Hello, Legion's families. This is Dr. Cognetta with your return to in-person instructions and health protocols. We'll quickly cover the screening and testing procedures, mask and face coverings, hand washing and cleaning, contact tracing, isolating, and quarantining, and the coordination efforts with state and local health officials. We ask that you screen daily before bringing your child to school for COVID-19 symptoms. This is one of the most important steps we can take together, as we do know that asymptomatic children rarely do spread the virus. However, symptomatic individuals are more likely to do so. The daily COVID-19 self-assessment is available here. Will also be emailed to you. You are free to request a hard copy as well. This is an example of passive screening. We don't ask or require for you to submit the results of this in any way. We just ask that you adhere to it before sending your child to school. Once again, this is one of the most important things we could do to help keep our school open and to be able to send our children confidently, knowing that they're going to go to a place where they can focus on learning with minimal distractions. ASA may schedule voluntary on-site COVID testing if it is determined to be necessary. Prior to doing that, we'll notify you, and your consent will be required before your child ever participates in COVID-19 testing. The type of testing that is conducted on children is the cheek swab. The current health guidance requires the use of masks or face coverings while indoors for all individuals. Masks are not required while outdoors. Students are free to bring your own mask from home. If not, we'll give one for you to wear while indoors. All students and staff will routinely wash or sanitize their hands, especially during transitions, before and after transitions, before and after eating, entering the classroom, and after using the restroom. High-touch surfaces, such as door handles and more, will be cleaned regularly. We'll also wipe down and clean materials that are used frequently, such as computers and other manipulatives in the classrooms. Contact tracing is a practice that is carried out when there is believed to be exposure to somebody who is positive with COVID-19. At ASA, the Director of Business Services, Health Tech, and I, as the CEO, will coordinate these efforts. A student who presents at least one symptom of COVID-19 while at school will be escorted to a waiting area where they'll be supervised by a staff member, and contact will be made with their parent to please come and pick up their child. We do ask that parents prioritize picking up their child under these circumstances. The health office will also work with parents to determine if the student has a documented health condition that may more accurately account for the presenting symptom. ASA currently does not, nor has any plan on collecting the vaccination status of individuals. However, the current guidelines do make recommendations based on the vaccination status of individuals. So we'd like to share those with you with hopes that they will equip you and your family to make the right choices based on the circumstances in your home. Quarantining is recommended when it is confirmed that somebody has been exposed to a positive individual. If vaccinated, the recommendation is to refrain from quarantining and or testing following the exposure if the individual that is vaccinated remains asymptomatic. If the individual that is exposed to someone who tests positive with COVID-19 is unvaccinated, but both parties were wearing a mask during their indoor exposure to one another, the student may continue to attend school if they remain asymptomatic, continue to mask while indoors, and undergo twice weekly testing during the 10 days from the exposure. It is also recommended that the student refrain from extracurricular activities outside of the normal school day. For an individual that is unvaccinated and was exposed to somebody while they were not wearing a mask, or the positive individual was not wearing a mask while indoors, here are the recommendations. If the individual that was exposed remains asymptomatic, They may discontinue quarantine under these conditions after 10 days from the date of the last exposure without testing, or after the 7th day if a negative test is collected after the 5th day from the exposure. If symptoms develop at any time after exposure, the symptomatic individual should isolate, get tested, and contact their healthcare provider. The health protocols shared in this video were developed looking at the latest California Department of Public Health guidance for schools. Per board policy and the agreement with our authorizer, Allegiance Team Academy adheres to all current prevention and mitigation strategies outlined for schools. Once the recommendations and guidance from the California Department of Public Health are revised, we'll revise our protocols and inform you as soon as possible. Thank you for your time and understanding of these protocols.